We're not going to be doing gross range of motion with our patient, and we use this a lot in acute care for determining if they have sufficient range of motion to use an assistive device or just as a general assessment. I also use gross range of motion because we're going to be talking a lot when we assess different joints that you always assess the joint above and below. And I'm not necessarily going to take the time to measure it. I'm going to assess it grossly to see if it has appropriate range of motion to begin with. And if not, then I will go ahead and take my measurements. Now, typically, one of the easiest ways, instead of me just explaining to our patient here what to do, demonstration is often the easiest way to go. And typically, I would be standing in front of the patient, but for the video's sake, I'm going to be off to the side, but typically you'd want to be in front of your patient. So for upper extremity gross range of motion, you're going to ask your patient, can you put your thumbs to the ceiling? And I want you to bring your arms up as far as you can. Very good. And again, we've talked about what's functional versus what is normal range of motion. Thumbs out to the side, and arms up. You bring your arms up behind your head. Can you cross your shoulders like that? Can you touch your shoulders and straighten your arms out all the way for me? And then wrist up and wrist down. And then I want you to make fists for me. And you can see how quickly that was and easy it was to do that gross range of motion. So I'm just looking for any deficits that I need to assess further. Cervical gross range of motion, you're going to have your patient sitting in an upright position, and you're going to make sure that they are sitting fully upright. And you're going to ask your patient, can you bring your chin to your chest for me, please? Good. Look up. And then I want you to look up towards the ceiling. Very good. Look straight ahead. And I want you to look over your right shoulder for me, please. Good. Come back to the middle. Look over your left shoulder, please. Good. Come back to the middle. Can you bring your right ear down to your right shoulder? And come on back up. And your left ear down to your left shoulder. And come on back up. And when your patient does side bending, the thing that you really want to watch out for is that combination side bend and rotation. So you'll see them do that, or they'll, go down and look in that direction. And so you'll have to bring them back to that neutral position again and make sure that they are doing actual true side bending. Gross range of motion in the lower extremity can be done in a couple of different positions. We're going to show the supine position first. And typically I would be on I am going to be on the same side as my patient. I'm on this side so that you can view. And really, this is just going to take a second. I can help my patient. And this can be passive or active assisted. And I'm going to ask them to go through that range of motion. And I can see they have more than 90 degrees in the hip, which is going to be functional and normal. They definitely have more than 90 degrees of range of motion in the knee here. I can check external rotation and internal rotation of the hip really quickly, and that looks good. And then I can come down here and do my ankle dorsiflexion and my ankle plantarflexion. Now remember, keep in mind though, that because I've got two joint muscles back here, in this position I've got the gastroc on slack, and so I would expect to hopefully see a little bit more dorsiflexion than if I have the knee fully extended. That's going to be a little bit more limited, but am I limited because of my joint mobility, or am I limited because of my passive restriction here with the muscle? So the other position to assess lower extremity gross range of motion is in a sitting position. And actually, once they're in a sitting position, you know they've already got 90 degrees of hip flexion, and we can see that they have 90 degrees of knee flexion. So if we're looking for functional activities, this is pretty much what we need for that. If we want to assess a little bit more, we can ask the patient to bring the knee up towards the ceiling on this side and the other side, and then ask them to straighten out the knee. So now I'm looking at knee extension, good, and the other knee. And then I can come down here and ask them to bring the toes up towards the ceiling, good, and then push down. And there's my lower extremity gross range of motion assessment. For gross range of motion of the back. This is really difficult to separate the thoracic region from the lumbar region, so typically it's going to be thoracolumbar range of motion. And to do a gross assessment, you're just going to ask the patient to slide their hands down their legs and reach for the floor. And you're looking for at least 90 degrees from the angle here, and see how far if they can go down and touch the floor or not. And go ahead and come on back up. We have a very flexible patient. And then we're going to ask them to kind of push their hips forward and then lean back, look up toward the ceiling. And so I'm looking for that extension in through here, range of motion. Come on back up. And we're going to remember that this extension normal is about 25 to 30, so that looks good. But we want to be careful that we support the patient, or the fact that they don't put their head too far back and do a lot of extension in the cervical region. We really want that extension to occur here. And then you're going to turn your patient, if you can turn to your left. Move your feet so you're looking forward to the left. Thank you. And really, even when I'm looking at gross range of motion, I'm going to have this open on the patient, so having a gown on or something so that I can watch what's happening to the curvature of the spine to see if there's areas where the spine is not moving as they're going through these motions. And now I'm going to ask them to slide their left arm down their left leg. And so that side bending here, you're looking to see that smoothness of the curve to make sure that it's a nice curve all the way through and not like that it's very stiff here and then curving above or below, and come on back up. And then slide down the other side. And grossly, you want to be able to see, can they touch their knees on both sides? And then you're also comparing, again, that curvature to see where they're getting that range of motion from. And come on back up. You can do rotation. Remember or understand that most of the rotation occurs in the thoracic region. There's very minimal rotation that occurs in the lumbar region. It's only about 2 degrees of rotation per segment, so you're talking 8 to 10 degrees of rotation. So really, it's negligible when you're trying to look at their entire rotation. So most of that rotation is occurring in the thoracic region. And so you're going to ask your patient to cross their arms over their chest, and you want to stabilize their pelvis to make sure that they are not rotating excessively or getting the rotation going down into their hips and their knees. And you're going to ask them to turn and look over your left shoulder. And again, you're assessing that rotation in through here, knowing that you don't get a lot in the lumbar, and back to the middle. And then turn and look over your right shoulder and come back straight ahead again. And you're looking for, is it equal on each side? Do they have any restrictions in one direction or the other? Now, if I don't stabilize the pelvis and I ask the patient to turn and look over their left side, go ahead and do that for me, please. You can see there we get a lot of movement in the hips and even down into the knees, and there's also a change in the feet. Come back to the middle for me, please. Thank you. And so we don't know then, is that motion truly coming from the spine, or they just have a lot of mobility in the hips and the knees, and that's where it's coming from. So that's why it's really important to stabilize the pelvis. We can also assess the functional range of motion in the lower extremity very quickly by asking our patient to perform a squat. So we're going to ask our patient to go ahead and squat for us, and we're going to be looking to see how far they can get down. Do they keep their knees behind their toes? And you can see with our patient here, she's having some difficulty and she's struggling to come on down into this position. And remember that we had our patient do some gross range of motion on the table, and she had normal gross range of motion, but she's having a lot of difficulty with the functional range of motion. And this is where their past medical history really comes into play, because if you have someone who has some knee issues and now they're weight bearing, that can have a great impact into how much range of motion they can demonstrate, how much are they functionally able to go up and down. So again, think about on the table, range of motion is full, and you might say they don't have any difficulties, but now you get them to do a functional activity and they do demonstrate some changes and some difficulties. So remember that we need to assess both active passive range of motion, but also functional range of motion is very important. So with the squat, again, you're looking to see how far they're getting down. If they can come down into this position, I am definitely demonstrating normal range of motion. My ankles are coming up or my heels are coming up, which may mean that I have an impact with my dorsiflexion, but definitely demonstrating normal hip flexion range of motion, normal knee range of motion as well. One of the other things you can look at it from the side is you want to make sure that the patient is keeping their knees behind their toes, that they're not coming forward into this position. You want them to do that butt down type if they can, because they're not using their legs as much in terms of strength if they have to come forward into this position. But again, if you're doing a functional squat, that's not as important as if you're doing some training, then you definitely want to make sure that they're doing proper squat mechanics.